Hello, my name is Gregory, and my presentation is going to be on ketamine, sometimes known as Special K. Ketamine is a dissociative anesthetic that was synthesized in 1962 as a less potent version of phencyclidine by Park Davis and Calvin Stevens. There are many ways it can be ingested. It can be snorted, injected, or smoked. Illicit abuse of ketamine began in the 1970s, and it became a club drug in the 80s. This was before any research had been done on the effects of ketamine when being used as a recreational drug. The mechanism of action is it's a fast-acting NMDA receptor antagonist. It also blocks HCN1 receptors, and it will interfere with NMDA opioid monoaminergic receptors and glutamate. And the parts of the brain that it affects primarily are the amygdala, the hippocampus, and the prefrontal cortex. And here is the chemical structure for ketamine. The effects of ketamine are it causes sedation. It can also be used for pain relief, and it's known to cause amnesia. And even though it's used primarily as an anesthetic by medical professionals, it has been known to be used to facilitate sexual assault and is also often abused to induce hallucinations and senses of euphoria. The symptoms of being on ketamine are hallucinations, agitation, cognitive difficulty, unconsciousness, rapid eye movement, dilated pupils, salivation, nausea, and stiff muscles. It primarily affects the urinary system, and more specifically the bladder. It can cause urinary tract infections, urinary incontinence, and interstitial cystitis. Research is still being done to fully understand how ketamine affects the urinary system. However, it is strongly believed that ketamine disrupts the functions of bladder cells, leading to inflammation and significant structural changes in the bladder. Ketamine is a Schedule III non-narcotic. It is a controlled substance, which means that it only has accepted medical uses in treatment. It has a moderate to low dependence and a high psychological dependence potential. It's FDA approved to be used as a general anesthetic. Some psychiatric use for depression, PTSD, and chronic pain. There's a nasal spray form of ketamine called S-ketamine that was approved in 2019, and it cannot be taken home. If someone is found to be in possession of ketamine without a prescription for a first offense, they can get up to a year in prison and a minimum of $1,000 fine. Repeated offenses may have up to 5 years in prison. It's considered a Class A misdemeanor or a Class C felony. Distribution or trafficking of ketamine can result in 5 to 20 years in prison. So ketamine is extremely illegal and only approved for medical use. There are also street names for ketamine, such as Green K, Honey Oil, Jet, Ket, Kit Kat, Special K, and Super K. And ketamine only became popular in the 70s, mainly due to anecdotes about the hallucinations that it was able to cause. And the reason it became so popular in the club scene was specifically for this. People wanted to induce hallucinations and feelings of euphoria, and that is how ketamine came to be abused. But it has a high psychological dependence, and is very likely to be something someone becomes addicted to.